Hi, my name is Dr. Jonathan Santoro. I'm an associate professor of neurology and pediatrics at the Children's Hospital Los Angeles and Keck School of Medicine. And today I'll be talking about primary periodic paralysis and really focusing on the diagnosis and treatment of this condition. So some background. Periodic paralysis is a term that really actually describes a heterogeneous group of disorders that are occurring at the neuromuscular junction and are associated with ion channel dysfunction. These episodes are typically resulting in painless muscle weakness and are often associated with a variety of triggers, which we'll discuss momentarily. There are many different causes to the condition, and we'll go through some of the differential diagnosis around periodic paralysis, what it may be confused for, and certainly speak specifically about some of the therapeutic interventions in this condition.
Indications. ORMALVI is an oral carbonic anhydrase inhibitor, indicated for the treatment of primary hyperkalemic periodic paralysis, primary hypokalemic periodic paralysis, and related variants. Important safety information, contraindications. Hypersensitivity to dichlorphenamide or other sulfonamides, concomitant use of ORMALVI and high-dose aspirin, severe pulmonary disease, limiting compensation to metabolic acidosis caused by ORMALVI, hepatic insufficiency, ORMALVI may aggravate hepatic encephalopathy. Warnings and precautions. Hypersensitivity and other life-threatening reactions. Fatalities associated with the administration of sulfonamides have occurred because of adverse reactions, including Stevens-Johnson syndrome, toxic epidermal necrolysis, fulminant hepatic necrosis, agranulocytosis, aplastic anemia, and other blood dyscrasias. Pulmonary involvement can occur in isolation or as part of a systemic reaction. Discontinue ORMALVI at the first appearance of skin rash or any sign of immune-mediated or other life-threatening adverse reaction. Concomitant use of aspirin or other salicylates. Carbonic anhydrase inhibitors, including ORMALVI, can cause metabolic acidosis, which can increase the risk of salicylate toxicity. Anorexia, tachypnea, lethargy, and coma have been reported with concomitant use of dichlorphenamide and high-dose aspirin. Concomitant use of ORMALVI and high-dose aspirin is contraindicated. Use with caution and carefully monitor patients receiving low-dose aspirin. Hypokalemia. ORMALVI increases potassium excretion and can cause hypokalemia. The risk of hypokalemia is greater when ORMALVI is used in patients with conditions associated with hypokalemia, e.g., adrenocortical excess, renal tubular acidosis type 1 and 2, and in patients receiving other drugs that may cause hypokalemia, e.g., loop diuretics, thiazide diuretics, laxatives, antifungals, penicillin, and theophylline. Baseline and periodic measurements of serum potassium during ORMALVI treatment are recommended. If hypokalemia develops or persists, consider reducing the dose or discontinuing ORMALVI and correction of potassium levels. Metabolic acidosis. ORMALVI can cause hyperchloremic non-anion gap metabolic acidosis. Concomitant use of ORMALVI with other drugs that cause metabolic acidosis may increase the severity of acidosis. Concomitant use of ORMALVI in compensated patients with respiratory acidosis, such as in advanced lung diseases, may lead to respiratory decompensation. Baseline and periodic measurements of serum bicarbonate during ORMALVI treatment are recommended. If metabolic acidosis develops or persists, consider reducing the dose or discontinuing ORMALVI. Falls. ORMALVI increases the risk of falls. Risk is greater in the elderly and with higher doses. Consider dose reduction or discontinuation of ORMALVI in patients who experience falls while treated with ORMALVI. Pregnancy and lactation. Based on animal data, ORMALVI may cause fetal harm. Use during pregnancy only if the potential benefit justifies the potential risk to the fetus. It is not known in humans whether dichlorphenamide is excreted in human milk. Exercise caution when administered to a nursing woman. Adverse reactions. The most common adverse reactions seen in clinical trials, incidence greater than or equal to 10% and greater than placebo, include paresthesias, cognitive disorder, dysgeusia, and confusional state. Drug interactions. Aspirin, anorexia, tachypnea, lethargy, and coma have been reported with concomitant use of dichlorphenamide and high-dose aspirin. The concomitant use of ORMALVI and high-dose aspirin is contraindicated. ORMALVI should be used with caution in patients receiving lower doses of aspirin. For more detailed information, please refer to the full prescribing information at www.ormalvi.com/PI. That's www.ormalvi.com/PI. To report suspected adverse reactions, contact Cycle Pharmaceuticals Limited at 1-857-437-3969 or the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. That's www.fda.gov/medwatch. Visit www.ormalvi.com. That's www.ormalvi.com for more videos about primary periodic paralysis.